So what's the difference between chiropractic and physical therapy? Let's say you have back pain and you go, should I go to a chiropractor or should I go to a physical therapist? Well, the short answer is choose one. We're both good. I'm a chiropractor. I am licensed in physical therapy through this state, so my license allows me to do both chiropractic and physical therapy, but I'm not an expert in physical therapy. The physical therapist who spent most of their education on physical therapy is the expert. I do what I know I can do best, which is chiropractic. So if you want to know how do I choose or when should I go to a chiropractor and when should I go to a physical therapist, we're going to talk about that today. And here's where we're going to start. Imagine that this person right here has back pain. And let's say the reason they have back pain is not anything crazy serious. What it is a misalignment of, let's say, the pelvic bone. Let's say this bone is rotated back. This one might be rotated forward and it's causing the pelvis to sit slanted. And when they walk on a slanted pelvis, there's muscle imbalances that develop, nerves that are irritated, and then there's aches and pains that develop. Over time, this is the person who comes in and says, you know, I didn't really have an accident, I didn't fall, just my back's been achy and it's been getting worse over the past few weeks and I decided I'd want to get it looked at. What the chiropractor will do is take maybe some x-rays, draw some lines on x-ray, do some assessments and figure out where the misalignment might be and adjust that misalignment. The physical therapist, well, they can manipulate as well, but they'll do it differently. And the difference between the adjustment and the manipulation is sometimes the manipulation is to mobilize, where the adjustment is to set the bone into the correct position. Again, this is a philosophical difference. What you need to understand is if the pelvis is misaligned and we do the typical physical therapy route, which I'm not against, but see if this makes any sense. The chiropractor will align the spine and then tell the patient to go to the physical therapist to train the muscles around the spine so that it holds the spine in the correct position. Now, what if the pelvis is misaligned and tilted and there is pain in the back? Now we do exercises. We strengthen all the muscles on the sides of the spine, on the abdomen, tighten that core, and build strength and stability around that spine. The problem with that is sometimes it will reinforce that misalignment and make it more permanent. And eventually it'll cause wear and tear either in the hips, where the person will need hip replacement, or in the discs of the spine, which would be these, and those discs will start to narrow, bulge, and degenerate. So my belief is that if we correct the alignment first and then do physical therapy, it's the better way. Just like if someone has to have surgery, they won't do physical therapy prior to the surgery. They'll have the surgery and then they'll do rehab to teach the muscle. Let's say if I had a knee replacement, we'll get that knee replaced by the surgeon first, then I go to the physical therapist and they're going to train me how to use that new knee properly. They'll train the muscles, they'll teach coordination and movement patterns. That's what the physical therapists are good at. That's what they should do. In our practice, we regularly refer patients to physical therapists when they need to learn to walk properly, when they need to do certain movement patterns, when we want to really strengthen shoulder muscles, rotator cuff, knees, hips. We always send them to the physical therapist to train those muscles, to neuromuscularly re-educate those patients. But when it needs an adjustment, when the spine needs to be corrected manually, chiropractic is better. Hopefully that made sense. You decide who you need to see based on that information. I'll talk to you next time.